Let's have a round of applause for Mr. Farook.
Thank you. It's good to see you all here. My name is Farook, and before I start, let me wish you all a Happy New Year. Thanks for coming for this program, and I wish all success for the organizers as well. So today, the topic given to me is basically general eye conditions in seniors. So I had an ambitious task which I'm trying to cover. So first of all, I'd like to declare that this is my disclaimer statement. This is just for information only. It doesn't replace any of your doubts. You still need to go for proper medical consultations. All right. So before we go into the program itself, okay, I have some questions for you before you ask me questions later on. Okay. So how well do you know? I mean, what is the most common eye condition you think that is preventable? Anyone in the audience can tell me? Any idea? Cataract, right? Okay, let's see. And how does vision have an impact on the quality of life? You think that does vision have an impact on quality of life? Yeah? Agree? Okay. And how well do you know your status of your eyes? You know, have you gone for screenings? Have you all, you have this like cataracts, you have to wear presbyopia, your Lavoie glasses must be updated every 2 years. Yeah, so you know those stuff, right? That's good. Okay, so we did a recent survey study in Singapore to find out the quality of life for those who have undetected cataracts. You know what is the findings? You'll be surprised that almost 70% of participants didn't know their status of their cataracts. Can you believe that? So almost 70% didn't know that they have cataracts and how it affects. And the conclusion of the study was that almost 2/3 of Singaporean adults have visually significant cataracts previously undiagnosed. And it kind of affects the impairment and seriously reduce their quality of life. So this was a very recent study to indicate that the importance of eye screening and to know more about your eye conditions itself. Okay, before going on to more detail of the my slides itself, I'd like to orientate you to the parts of the eye so that it's easier understanding of how we can understand the topics itself. So, first of all, the front part is what we call the cornea. And then this is the anterior chamber where you have fluid flowing in. And then this is the lens, the crystalline lens, which helps you to focus near objects of afar, to focus on the retina itself. And this area here is considered as your posterior chamber, where the vitreous jelly is. And these vessels you see here, this is called the retina itself. And this is basically your optic disc, which conveys the message back to your brain itself. So just try to have a understanding of this part so that when we go into more detail of the topics itself, it helps you to understand or orientate which part we are talking about. Okay, and due to the lighting, I'm sure I don't think you can appreciate this photo very well. This is actually a back of the eye. This is what we call the retina itself. So again, we have the optic nerve. This is where the exit of all your nerves goes to the brain. And these lines here represents your blood vessels. Okay, so I'm going to cover a few things, very ambitious of mine, so I'll try to justify my talks, but it will be a very, very bird's eye view. So it won't be very in detail, but I hope to cover in my allocated time. So first of all, we tried dry eyes, cataract, floaters, diabetes-related condition called diabetic retinopathy, glaucoma, and AMD, age-related macular degeneration. These are kind of common conditions that we see among seniors. Seniors meaning, usually we have understanding it's like 50, 60, but most of the problem starts when you're almost 40 and above, you start having problems in the eye. So it's very important that's why we also put a age limit or age criteria to start for the screening that starts from 40 years and above. Okay, so first of all, we'll start from the anterior side. Okay, so dry eyes. Okay, this is a very, very common condition that we see almost every day in our hospital, in the center, in the eye practices like optical and everything. So dry eyes is a very common condition. One of the reasons why we see eye practitioners. Eye practitioners basically means eye doctors, optometrists, those who are involved in the eye care itself. And it can affect young and old. it's not only a senior's condition, it can affect young and old, and usually it's due to insufficient lubrication of the ocular surface itself. And before we understand the nature of the dry eyes, we have to understand there are three types of tearing that occurs. One is called a basal tear. That means that's a continuous normal tearing in the eye that's happening, that is produced by the lacrimal gland that flows to make our eyes wet and nice. And then there's this emotional tearing. So sometimes we cry of joy, cry of sadness, and these are because of emotional issues. Okay, the other one is called reflex tearing. Reflex tearing is when you have something that is triggering off. Suppose I've been blowing into my eyes. This is an external factor. Or I have sand go into my eyes. These are external factors. Because of the irritations, I get reflex tearing. When you cut onions, you get reflex reactions. So this is when you produce more tears than the normal level of tears. So if you look at the picture itself, you have, this is the cornea itself, and then you have the mucin layer, the water layer which makes up majority of the content, and then this is the oil layer. So these three layers are produced by three different glands in the eye itself. So if there is an improportion of any of these conditions that is produced, then of course you get tear deficiency, meaning to say, if your oil layer is not sufficient, then of course the watery part of the component of the eye gets faster evaporated off. If let's say if the mucin layer is the one that sticks to the eye, if it is not produced enough, then of course then your tears will not stick onto the eye itself. Okay? So this is basically the body's mechanism of creating that, you need to have the right proportions of the tear production. If any of this goes wrong, then of course you get dry eyes issues. So the symptoms of dry eyes is basically, sometimes you get blurred vision, meaning to say if you blink, if you have a blurred vision, you blink a few times, the signs will get better. So it's not so much of a refractive error. And you get itchiness, like sand in the eye, something that's, you try to wash it off, but it doesn't go off. Eye redness, tearing. Okay, I'm saying dry eyes, and here I'm saying tearing. So what is this condition? I mean, what level are we talking now? Is it a basal, emotional, or reflex? Anyone? When I said dry eyes, now I'm saying there's tearing here. That means you're producing more tears than what you're supposed to. So which condition is this? No, it's more of reflex, because of irritation. Irritation, so that's a good try. So but it's a reflex tearing of the eye itself that tries to wash off the irritants. And then some eye pain, like, it feels like poking pins and needles. Sometimes patients describe the sensation as if they have like needles poking in their eyes. So these are symptoms of dry eyes. So what can contribute to dry eyes itself? First of all, mostly is this age. So as we grow older, there's hormonal changes, especially for females. Menopause takes in, and then this hormonal imbalances cause to have dry eyes. Environmental issues, meaning to say whether you're indoors or outdoors. Indoors could be like, when you have aircon blowing. Outdoors could be when you have sandy, sands coming in, flying into your eyes. Or this kind of environmental issues can also cause dry eyes. Near activities such as using too much of your phones without blinking, having proper rest, and all this cause you to have dry eyes. Medication, certain medications, like when you take antihistamines, meaning to say you take medication for your allergies, they can have a side effect to cause dry eyes. And of course, if you are using contact lens, then of course you know what we are talking about dry eyes here as well. And eyelid issues, meaning to say when you have eyelids which are not properly, that means due to aging, if you have the tonus of your muscles are not strong enough, then of course also can cause dry eyes issues. And health conditions like say thyroid and smoking can also cause dry eyes. And what are the treatments for dry eyes? The very easiest method is to have breaks. Do complete blinks. And of course, use lubrications. And if you have environmental factors that is very obvious, meaning to say if you have something that's blowing into your eyes, of course then sit away from that triggering factor. And of course, you can always take supplements or medications to increase your tear productions, and of course sometimes you also can do some lid hygiene treatments such as warm compresses and having your lids well maintained, meaning to say you should use shampoo, or when you wash your face, you should try to make sure that your lids are also cleaned. Okay. Okay. Next, we will go on to the second part, which is the lens itself. Okay. So, can you? No. Yes. Yeah. Depression trigger dry eyes. I don't think so. But of course, if you are like staring into the sky, let's say depression, you are looking, you're wondering, just staring at somewhere, trying to think of something without having proper blinks. That means you need to have a certain number of blinks per minute. And if you're not blinking enough, of course, then that can trigger off dryness. Depression linked to cataracts. Dry eyes doesn't link to cataracts itself, but you're talking next about cataracts, so you probably will get to understand what cataracts all about. Yeah, thanks for the questions. Okay, so here now we are going to talk about the lens issues. Okay, so what we are talking about is cataract. In Chinese, you call mo, pai nei chang, and all those, So basically, cataracts are something that is caused by clouding of the natural lens. Usually, our natural lens is very clear, like a glass. When you're born, it's very clear. So as we age, because of UV, because of aging, the protein nature of the eye, the lens itself changes. And that's when you start to have cataracts. And it usually occurs once you hit 40 and above. But it doesn't mean that at the start of 40, you start getting lens changes. There might be very, very early changes, but usually the most significant time when you start seeing cataracts are when you're 50s, 60s. And that's one of the main cause of preventable blindness, meaning to say, in the world, if you go to undeveloped countries, many people are blind. But it's not blind because they're diseased or they cannot use their eyes. It's because they have no treatment for cataracts. So the moment you remove the cataracts, they are able to see again. So this is one of the primary causes of preventable blindness in the world. And cataracts can form many types. Here, because of lighting, I'm afraid that I can't appreciate to show you the different types of cataracts. So sometimes you can have a very wide cataract, which is very common. Sometimes you can have this kind of spoke light, or it's very difficult to see here. But these are all the different types. Sometimes because of trauma, that means you have, when you are young, you had something hit your eye, or you go for surgery, when sometimes the instrument hits the sensitive part of the lens, you can also develop cataracts as well. But primary reason for cataract development is usually age. And also you have grades of cataracts. That's why when you say 40 and above, we don't say the first sign of cataracts, we don't operate. We take time because the cataract has to slowly develop until it's ripe enough, it affects your quality of vision, then we operate. So the symptoms of cataract usually, there's no symptoms at the very early onset. There is changes to the lens, but there's no symptoms. As the cataract grows further, you start to get visual impairment, meaning to say you can't see, the quality of vision is very poor. You try to change your glasses, it doesn't really help you very much. You get glare, hazy vision, and sometimes you also need to change your glasses. Because of the refractive index of the lens changes, you start to have refractive change power. So you need to keep changing your glasses. But these are all temporary measures, because as the cataract gets worse, you change your glasses now, in 2 years' time, you are back to square one again. So we need to see when is the right time to operate. And you also get poor contrast, your color vision is affected, meaning to say you cannot appreciate the environment itself. That means the quality of your TV screens, the quality of your pictures you see are all affected because of cataracts. And you also get difficulty in night vision. So people with very dense cataract, they prefer daytime vision compared to nighttime vision. Patients with cataracts tend to have, when they drive at night, they find that it's causes lots of glare. So they prefer to drive in the daytime itself. So this is again a visual simulation of clear vision, blur vision, and also how cataract can cause scattering of lights to produce glare and halos. So the causes of cataract is usually, as I said, age, trauma, surgery. UV exposure to UV is also a contributor to cataracts. So the more outdoors you are in, the faster your rate of cataracts will get. So what we'll recommend is if you're a very outdoor person, try to get UV filtered glasses or try to wear sunglasses when you're outdoor playing or when you're in the outdoors. Sometimes certain medications such as steroids, obesity, diabetes, high blood pressure, smoking also can contribute to cataract formations. And usually the treatment for the early stage of cataracts is glasses, just upgrade your glasses. But again, as I say, it's only a temporary measure because as the cataract gets worse, the glasses will not be much of help. So eventually you'll need to get to go for surgery when there's a significant amount of cataract where the doctor says, okay, now is the time for you to go. Or you tell the doctor that no, it's really affecting your quality of life. And so then it's a combined decision between the doctor and the patient before we go into cataract surgery. But bear in mind that any surgery that you go, there's always a risk that you have to understand. No surgery is 100% safe. So you have to understand, you have to weigh the risk between the benefit and the risk before you go into a surgery. And so the doctors will discuss with you in more details. So next we move on to the posterior chamber. So posterior chamber, what we are talking about is basically this area. The most commonest, other than cataracts and dryness, we get is what we call floaters. Floaters is something that you tend to see, especially when you are looking at a blank screen in the outdoor area, when you're staring at the skies and things. Suddenly you start seeing like some black spots flowing around or strings flowing around, and these are considered as what we call floaters. They can be accompanied by flashes of light, may or may not. Okay. And usually it appears, as I said, under very bright lights, under bright walls. And usually most of us do tend to have one or two floaters if you really observe very carefully. Okay? But sometimes we don't take floaters very lightly because it can also be an indicator for, that means you have an impending retinal tear or retinal breaks as well. So it's very important that we assess every floaters, whether is it a benign condition or it's supposed to be some indicator for retinal detachment. And again, I can't show you this picture very well because of the outdoor lighting, but as I described, I'm sure you're able to grab the idea what floaters really look like. So the warning signs that we usually give for patients who come to us with floaters is basically that they are supposed to look out for a showering of floaters, meaning to say it's not just one or two floaters and then the next year they come in, there's another one more, another one more. It's not like that. It's just that you have floaters that are many. That means you really shower lots and lots of it, like as if you threw your tea dust onto the sky. So that kind of level you are looking at. And it may be accompanied by flashes, meaning to say the jelly in the eye, the back of the eye, starts pulling on the retina, and this triggers off the nerves, which gives you this lightning sensation. And so, and the other effect is also a curtain falling effect. That means, as if, just imagine wallpaper. The wallpaper is stuck to the wall, and if let's say you start peeling off, in that sense, your retina is also trying to peel off from the retina itself, the anchoring points. And that's when you start to have this curtain falling effect. That means you cannot see from sideways or top or down. These are very, very crucial indicators that you need to go and seek immediate medical attention because it might be due to retinal tear or breaks. So who is at higher risk? Usually floaters tend to occur with patients who have a family history. That means their parents had retinal detachment and things like that. So usually it can be a family history. Those who are very high myope, that means those who are very short-sighted, that means 700 degrees, 800 degrees. These people are at a higher risk than normal people. And usually if you have gone for eye surgeries, eye injuries, and also if you have conditions such as diabetic retinopathy, these people are more at higher risk of getting retinal tears and detachments. Okay? So later on we'll see why diabetic retinopathy in particular. The back part of the eye, the retina, the macula, and the nerve itself. Okay, so I was talking to you diabetic retinopathy with floaters. Anyone can tell me why is there a relationship between diabetic and floaters? Anything? Okay, probably after the talk you will get to understand the relationship, okay? So when your diabetes is very bad, that means your blood sugar is very high, and in prolonged duration of your diabetes itself, that could cause you to have changes in the eye, which we call diabetic retinopathy. Okay, and usually the blood vessels in the eyes are damaged because of the high blood sugar level, and they start leaking. They start leaking blood, they start leaking waste products as well. And these are signs that we see as diabetic retinopathy, and it's also because of the blood is leaking out from the blood vessels. Usually when you have a cut, what happens? You start forming scars. So when you have scars, they start to contract on the tissue. And when you have contraction in the jelly itself, you start to pull on the retina. So it also appears as if like you have floaters. And if they start pulling on the retina, you can also have potential retinal detachment. And if the bleeding is right at the sensitive part of the eye, and it can block your vision as well. So it's a potentially sight-threatening condition. So that's why you shouldn't take diabetic retinopathy very lightly. And usually you understand the difference between insulin and blood sugar level. So when you consume food, you need the food to convert to glucose. And the glucose has to be converted to be transported to the organs for energy purpose. So to carry out this process, you need insulin. So sometimes when we are talking about type 2 diabetes, which is more common than type 1 diabetes, so that means you are normal in the early stages, and later on, because of sugar levels very high, you produce insulin, and the insulins are either insufficient or the insulin is not able to convey that glucose into your organs. That's when you end up with having a very high blood sugar level. So when you go for your blood test, then you find that hey, actually my HbA1c level is almost 6.5, 7. So 6.5 is already kind of a pre-indicator that you're pre-diabetic. So the doctors will advise you on diet control. When you're more than 7, you'll start getting changes in the, potentially changes in the eye. So that's when you start taking either medication, you need to change your lifestyle modifications. So these are indicators where you see the relationship between your insulin and blood sugar level. So usually when you have diabetes, that means uncontrolled diabetes, you end up having blur vision. So sometimes you can have you could have just changed your glasses just recently, but because of your uncontrolled sugar level, you start to have poor vision as well. You think that it's because the glasses are wrong, but actually it's because of your lenses are not stable. Because of high sugar level, your refractive status are not stable at all. So in that, you end up with a change in refractive index. So when you have very high sugar level, it's not very advisable to go and make glasses. So until you control your sugar level at a stable rate, then you can update and see whether is there changes. So don't jump into conclusion that you need to go and change your glasses when you have very high sugar level. So always bear in mind to keep your sugar level normal first before going for checks. And you can also, as I say, you can get floaters and black spots in the eye. So these black spots could also resemble blood clots coming out. So it can be, when you're talking about floaters, it could be floaters as per the degeneration of the vitreous. It can also be because of diabetes. And you can also get poor wound healing. So usually, for diabetic patients, we always tell you to wear footwear at home, try not to bang into things, make sure your wounds are properly clean and everything. So again, when you have a high injury as well, it doesn't heal very well. So it's you get in a very poor control, you get poor wound healing as well. And also the cataracts tend to develop much faster in diabetic patients. Okay, I think I need to skip this because this is basically a pictorial description of what I was mentioning just now. So usually you have diabetic retinopathies are graded as mild, moderate, severe. So in mild stages, usually we tell them to control your sugar. When it goes into moderate and severe stage, then we need to think of what are the treatments we can do. So we tell them to offer them a laser treatment to burn off the blood vessels so that they stop bleeding. If not, if you keep continuously bleeding in the eye, then you end up with scars and potentially you can lose your sight. And you can also have a swelling in the center part of the vision itself. So the treatment for diabetes is basically good sugar control, lifestyle modification. You need to take your proper medication. You cannot skip your diabetic medicine like one day you take, one day you forget about it. You should make sure you maintain your medication. You should visit your doctors regularly, go for your blood test. And I mentioned about laser therapy and eye injections. If you have moderate to severe. So this all depends when the doctor assess your condition and they say, okay, they feel that you need to go for laser, or when you have eye swelling, they'll suggest you to go for eye injections. Okay, next one I'm going to talk about the macula. Okay, so this is the central part of, very sensitive part of the retina itself. When you're looking at the screen, you're actually using your macular function itself. And this one goes on to age-related macular degeneration. So when you have age-related macular degeneration, the word itself tells you it's because of your aging. The sensitive part of the eye gets worn out, or gets the poor vision causes by thinning of the retina, and usually causes blur vision among elderlies. So usually for elderlies, when they are in 50s, 60s, they find that even though they have corrected their glasses to the best possible, they still find that the vision is not as good as what they felt previously. So there could be a potential for age-related macular degeneration condition. So usually AMD is classified as two types. One is dry, which is the more common type, and the wet type, which is less common, fortunately. Because when you're wet type, you need intervention, such as surgeries and all. But when you're dry type, usually it's just basic modification of lifestyle. Okay, so again, I can't show you the pictures to describe the dry and the wet, but you can always look up on the internet. You just type in dry AMD, wet AMD, you look for images, you will understand what I'm trying to say here. Usually dry AMD, you just have some like yellow spots, which is bruises we call, because these are just waste products of the retina. Whereas wet AMD, the blood vessels actually kind of creeps up from the protective barrier as they start to have blood leaking in. Okay, so that's one you need treatment. And in early stages, usually you don't see any symptoms, but when you have swelling, when there's changes, they start to have gradual central loss vision. They start to see distortions. When you read, when you look at things, there's distortion. The lines don't appear straight. These are the indicators to say that your central vision is kind of affected. And then it's time that you need to go and look for further medical attention. And this is what I was saying. If you look at, this is one chart that we usually give for AMD screening. So what happens is, this chart itself is supposed to be all straight lines. They are supposed to close one eye and just look at this black spot and to see for any waviness or crookedness in this kind of conditions here. So when you have swelling or changes in the macula itself, you start to see waviness. This is quite advanced. Okay, so you need regular follow-ups for AMD conditions. So usually for dry AMD, we just do monitoring, supplements, lutein, or healthy diet. And in the worst scenario, sometimes you need magnifiers. That's what we call low vision aids. When the dry AMD develops into a wet condition, then you will need some laser treatment or injections to control the condition itself. So I think this is my last condition which I'm going to talk about, is called glaucoma. So glaucoma is also another condition that affects the elderly in most of the situation, and it's very silent, so you don't really know that you have glaucoma itself. So it kind of affects your nerve. This is the nerve that brings all the information that is received from the retina back to the brain itself. And usually the contributing factor is due to the pressure buildup in the eye itself. Just like you have blood pressure in your body, the pressure in the eye can also increase, causing to have damage on the nerve. So fluid is actually produced at the back of the, at the side of the lens here, and they go through the pupil in front of the lens, and they drain out at this, what we call the trabecular meshwork. So when you have this production and drainage, when there's a problem, is either increased production or slow down in drainage, the pressure in the eye can build up. And when the IOP is raised, you can have damage because there's no way the pressure can escape. So the only way the damage will be on the nerve itself. And when you have damage in the nerve, okay, before going into all that, basically there are two types or three types of glaucoma. There's open angle glaucoma, there's closed angle glaucoma, and there's secondary glaucomas. So the main cause of glaucomas in Singapore, or especially among the elderly, are mainly open angle, meaning to say they are very silent. It's only when you go for screenings, when you go for regular checks, you will be able to find that no, you have glaucoma. When you have close angle glaucoma, that's an acute type, meaning to say you can get a sudden attack whereby you get headaches, vomiting, red eyes, painful eyes, and you find that it's because of the drainage part of the eye. The drainage part of the eye is very shallow here. So you end up having needing to go for urgent treatment for this. Okay, but majority of patients are actually more of open angle glaucoma. Okay, secondary glaucoma could be because you have very poor control. Again, diabetes could also contribute to glaucoma as well. That's when you have when you have diabetes, very poor control, you start having what we call proliferative diabetic retinopathy, meaning to say you start developing new vessels. The vessels in the eye the current vessel in the eye is not able to sufficient the exchange of nutrients to the eye, so the eye will start developing new vessels. And when you have new vessels, not only in the eye, you can also have in the front part, the iris itself, and it can cover your drainage part. That causes secondary glaucoma. And this is basically a picture to describe how does a normal nerve looks like and how does a abnormal nerve looks like. And one of the tests we do for diagnosis of visual field, glaucoma, is what we call a visual field. So this is basically to test how much of peripheral vision you get. So meaning to say, when I'm looking at you all, I can see the side of the wall. So for glaucoma patients, they tend to have, if they are untreated, the visual field gets lesser and lesser and lesser. So this one can only be done by testing. And this gives you another description of how the visual field changes. So these black spots mean these patients cannot see at certain areas. And as the glaucoma advances, you find that the black spots increases. So this is to indicate to us that the glaucoma is getting more and worse and worse. So they need more medication, they may require surgeries and things. And this is again what we call the normal visual field. That means you can really see at least one, when you open up your arms, you can see your thumbs. This is considered as your visual field. But when you have glaucoma, this field can actually, this again is a pictorial description. The black areas is, okay, if you look, the picture is full, right? So when you have glaucoma where your sight vision is affected, you find that these black spots or black area, this black area kind of shrinks the image. You don't really see the black spot. What the picture is trying to describe is your view gets smaller and smaller. So from a big picture like this, your vision starts shrinking, and as it advances further and further, you end up with a very small tunnel channel vision. So that's why you find that patients with glaucoma, their central vision is very good, they can see very well. But when you tell them about sight vision, it's only when they have very advanced, they start to hit into objects when they're walking, then they realize that, hey, actually my vision is not, the peripheral vision is not as good as it used to be. So that's why glaucoma is very silent. In other words, it's also called as silent thief of vision. Okay, usually for glaucoma, in the early stages, we start with medications to control the eye pressure. When you have eye medication for glaucoma patients, it's very important that they are very compliant on their medication drops. Again, they have to be very regular so that their pressure is under a normal constant level. If not, you skip or you tend to forget, then you have spikes of pressures, and again, you will not be able to control your glaucoma itself. And when the pressures are still high despite medications, then we start going into lasers and surgery. So when the vision is really affected, then we still have to go back to low vision aids, meaning to say magnifiers and certain lenses to help with this peripheral vision loss. Bear in mind, glaucoma is a permanent condition. That means you cannot treat. Whatever is damaged is damaged. So what we're trying to do here is to preserve the vision itself. Okay? So I think I am more or less done with my presentations. I'd like to thank the organizers for their opportunity to present this talk here, and I also wish them all the best for their community project. And yeah, so If there's any question which I can answer, it'll be good. Yes. Okay, the question is, usually floaters tend to be, what I described was mainly outdoors. What if the floaters was indoors as well? Usually, the indicator is we see under bright lights. But if you see it indoors as well, you need to examine you. It could be normal, that means the floater is right at the center part of vision. So that's why you can also see indoors as well. But it doesn't mean that you should just ignore it. You should just go for a check. If it's persistent, and after the doctor has done a thorough check, there's no retinal breaks holes, just keep a lookout for the signs I told you. What are they? Not a lot. Anyone else can help? What are the 3 indicators of floaters which I told you, the warning signs? No showering of floaters, that means lots of it. What's the next one? Flashing, yes, good. Flashing of light, that means you can get lightning strikes or sparkles. Okay? It may or may not be accompanied, but you still have to look out for. What's the third one? Third one. Wallpaper. What's that? The third symptom. Huh? Curtain, yes. Curtain falling effect. Okay? So just bear in mind, if you forget everything here, your floaters are very common things. Just take these three important points here. Flashes of light, showering of floaters, and curtain falling effect. Meaning to say you cannot see suddenly, you cannot see from sideways, suddenly you're looking, hey, how come I cannot see suddenly? No, or you cannot see from top or down. These are curtain falling effect. Okay, these are very important. This one, when you have this, it's very important that you go and see immediate medical attention. Okay? Yeah. Any other questions? Okay, thanks so much. Yeah, I'll hand over the mic to the guys. Thanks.